All right, good morning, everyone. Dr. Randall Gates, board-certified chiropractic neurologist, also a chiropractic physician at Gates Way to Health. And today we're doing the second part of our double header. We're talking about Sjogren's syndrome and H. pylori. And we're joined by Kathy. Good morning, Kathy.
Good morning, everyone.
All right, so now we're talking about Sjogren's. What is Sjogren's? Sjogren's is an autoimmune condition that affects the production of saliva and tears. People who have Sjogren's syndrome typically present with a really dry mouth and dry eyes. And it's actually a pretty disabling condition because their mouth gets incredibly dry. It can dramatically affect the dental issues because when you don't have any saliva, your ability to break down sugars is impaired. And as a consequence of that, then people can get dental caries, so on and so forth. So Sjogren's is no fun. And there's a primary and secondary form of it that we'll talk about. And I think it's important that we talk about these connections to gut bacterial relationships because it's becoming more and more pronounced in the literature. And in my experience, a lot of Sjogren's patients don't have any concept of that. Most of the time when a Sjogren's patient says or is told that they have the condition by a rheumatologist, they're told we don't really know what causes it. All you can do is basically take XYZ medication. This medication help you produce more saliva. Take these eye drops. Take this immune modulating medication. So that's the story. So Kathy, where did you want to start?
Well, how do we diagnose it? Is it blood work or?
Primarily via blood work. So if someone is suspected of having Sjogren's, usually doctors start by running an anti-nuclear antibody test, which is a nebulous test for autoimmunity. It can also be seen in normal individuals who are women around the age of 45 to 50 plus. It can be seen with cancer, it can be seen with Hashimoto's, it can be seen with parasites. So ANA just says, oh, there's something going on. And from there, then doctors will typically run something along the lines of what's called a lupus panel. And in the lupus panel, that's how Quest Diagnostics designates it. Basically, you're going to have things like SSA and SSB antibodies, which are specific for Sjogren's. And there are other antibodies like Smith and RNP antibodies and SCL70 antibodies and this myriad of other antibodies, DSAANA antibodies that tell you, okay, if there's this one, it looks more like this condition. If there's that one, it looks more like that condition along with the clinical presentation. So Sjogren's is not completely a clinical diagnosis, meaning you have dry eyes, that means you have Sjogren's. No, you have to have the lab testing to further substantiate it. And there can also be salivary studies that can test how much tearing you have in your eyes. And all of that comes together to say this individual has Sjogren's. So yeah.
So what do we get into when we're looking at primary versus secondary?
Really, primary Sjogren's is just Sjogren's. I don't mean just lightly, but so primary is when an individual has Sjogren's. Secondary is when an individual has something like lupus or rheumatoid arthritis, and they also have Sjogren's. And so basically, you know, it's just all labels. It's all diagnostic classifications. Functionally, we're seeing that so many of these conditions relate to the same problems, but maybe different offenders. So we talked about a year ago, and we highlighted on it again this year, this relationship between lupus and, pull up the chart here. So in lupus, researchers have found that a gut bacteria, Enterococcus gallinarum, goes into the blood. Now, what isn't shown here is that you have a ton of blood that goes from your gut to your liver over here. Why? Your liver is your filter mechanism. Most of us know that. Well, the portal circulation, as it's termed, is all this mesenteric blood that then goes up to the liver. Well, researchers found that this Enterococcus gallinarum bacteria goes from here to there. Sorry, it's always backwards. Here to there. And this Enterococcus gallinarum then lives in the liver, and that triggers the lupus response. So that came out in the journal Science in 2018. Rheumatoid arthritis, they found 3 different bacteria, one particularly that seems to stem from the gut that then goes into our joints and triggers the specific autoimmune reaction known as rheumatoid arthritis. And with Sjogren's, we're finding other bacterial relationships to this condition. So in the functional rheumatology, integrative rheumatology world, this is what people are talking about. Medically, they just say, oh, you have primary Sjogren's, you take this medication. You have secondary Sjogren's, so we're going to treat you for the rheumatoid arthritis and lupus, and we'll give you this added medication for Sjogren's. So that's the difference in paradigm, so to speak.
Okay.
Yeah.
And we don't really like that, do we? In the functional integrative medical world, we would like to do something else other than take all those medications.
Exactly, and that's where we focus on getting to the underlying cause, as cheesy as that sounds. It's kind of a lost thing in today's healthcare system when it comes to these chronic conditions. So yeah, we look at it differently, and that's our proclivity, so to speak. That's what makes sense to us. I'm not saying that those medications used for something like rheumatoid arthritis are bad. If it helps you to function, wonderful, and that's great. But I feel that these really, really good Band-Aids are also causing people to just kind of turn their head the other way and not think of, okay, what is causing my RA? What is causing my lupus? What is causing the Sjogren's? Yeah, or doctors talking about it as much. Yeah.
So what is the H. pylori connection to Sjogren's and those autoimmune disorders? Everything we just talked about in the gut, I mean, there's something.
Yeah, so H. pylori, Helicobacter pylori, is a bacteria shown really accepted in the 1990s as the cause of ulcers. So probably when you were growing up, Kathy, doctors would say stress is the cause of ulcers. And then it came out in the 90s, this doctor basically suspected that H. pylori was the cause of gastric ulcers. So he inoculated himself with H. pylori and he developed stomach ulcers. And that got the attention of the medical community, and now it's widely accepted that if somebody has ulcers, we need to think H. pylori. And so with that, basically, researchers started looking at, okay, what is the prevalence of H. pylori? And we find that a lot of people have H. pylori. So upwards of 50% of Americans have H. pylori. In some countries, 98% of people have H. pylori. So it's kind of a ubiquitous bacteria that can reside in the stomach. Well, how does it reside there and not cause problems for some people and cause problems for others? And that's where researchers are saying if you have H. pylori, it can be associated with ulcers, can be associated with other autoimmune conditions. So probably 6 months ago, Kathy and I talked about a condition called autoimmune gastritis. And that is where the immune system literally kills and attacks the stomach lining. Well, when that happens, individuals can develop stomach pain, they can develop nausea. So if you know somebody with stomach pain and nausea and acid reflux and they're taking proton pump inhibitors and antihistamine medications to help them with that and they're not feeling better, well, they may want to be screened for autoimmune gastritis and H. pylori. For those who have B12 deficiencies, everybody these days, sorry, I'm going to take the poster down because my arm's getting tired. Everybody these days is taking B12. Well, why is everyone taking B12? They have a suspected B12 deficiency. Really, no one should be deficient in B12 who's eating meat or eggs. And so if you're eating meat and eggs and you're deficient in B12, you really want to raise the question of something like autoimmune gastritis, where the immune system is attacking the stomach, killing the cells that make intrinsic factor, which binds your B12 and then takes your B12 down through the intestines to where it's ultimately absorbed down at the terminal ileum, the farthest part of your small intestine. So researchers started looking at that, and then they saw that H. pylori was associated with mucosal-associated lymphoid tissue lymphoma, basically. And so they saw associations to cancer. And then they started seeing associations with Sjogren's. And how is it? Well, this whole concept is referred to as molecular mimicry. So if your immune system is attacking a bacteria, and if the immune cells of that bacteria then look like your salivary glands or your lacrimal glands, then that can lead to the Sjogren's process. Or it's also possible that in attacking the H. pylori, the immune system gets so overreactive that it creates other immune cells that then start attacking the lacrimal and submandibular glands and your salivary glands and things like that. So that is how the H. pylori mechanism causes or is heavily associated with Sjogren's.
Okay. So the next question is, should patients be treated for H. pylori?
And that is coming out now as a yes. Now, are most doctors aware of that? I'd say probably no, because this is brand new information in terms of the treatment. But yeah, there are research articles coming out, I can send anybody who wants, where they're saying particularly for older individuals with Sjogren's syndrome, they do recommend eradication of the H. pylori bacteria because it is coming out where there was a meta-analysis done in the journal Medicine in 2018 looking at this specific issue, and they said, okay, people have been talking about H. pylori and Sjogren's for a while. There are some research studies saying an overwhelming yes, this association is important and we need to deal with it. There are other research articles saying, yeah, I don't know. And so they did this meta-analysis and they said, yes, overwhelmingly, Sjogren's and H. pylori, that association is strong, and we need to be looking at eradicating the H. pylori based on other research studies that have been done. So yeah.
Okay, and the other interesting thing I found, and I'm going to read this list because this is what foods to avoid with Sjogren's, but I think it's also the list of foods you avoid with all autoimmune diseases.
Right.
would be red meat, processed foods, which we've talked about a lot, fried foods, the dairy, sugars and sweets, alcohol, soda, and gluten. All of those were listed as things to stay away from if you have Sjogren's. But again, for autoimmune, this is pretty much the list, isn't it?
It is, but that gets into a really good point. So I talked to a patient recently who had an autoimmune disorder, and their doctor put them on this type of diet. Now, first of all, 10 years ago, that never would have happened in my experience. I was talking about diet a long time ago. And I mean, not like I was the first person ever to do that. I mean, you know what I mean? Like, people have talked about diet.
You're too young to be the first person to have ever done it.
Exactly. People have talked about diet for a long time. However, being in this natural paradigm 10 years ago, it was not well received. People had minimal concepts of gluten. So when you'd say eliminate gluten, people's eyebrows would furrow. Fast forward to then, like in 2014, about 5 years later, I think it was 30% of Americans or something like that had tried going gluten-free. So all of a sudden the fad had caught on. More people were aware of things like gluten. Where am I going with this? So now we have doctors recommending the autoimmune paleo diet in mainstream healthcare circles. Well, the issue is that we work with like 10 or 11 different diets here at Gateway to Health because no one diet is right for one person. And what I frequently find is that something like the paleo diet is actually bad for a lot of patients who have autoimmune disorders, because then you're eating a lot of really carbohydrate rich, not bread, not grains, but other types of carbohydrates that can inflame the gut bacteria. So this is where I've seen things like the paleo diet actually be bad for patients with autoimmune disorders. So if you go on something like that, just like the patient I was talking to this week who had an autoimmune problem, they're like, oh my gosh, I felt so much worse being on this diet. Well, it's because you're eating exactly the wrong foods for your gut bacteria. So it's all about your diet and your gut bacteria. So that'd be my answer to that, Kathy, but that's a great question.
Okay, and that goes back to the really in-depth testing that you do to determine what is the right diet.
Right.
Like you said, I mean, yeah, you're not eating breads, but what, you're eating a lot of nuts or, that sort of thing. So yeah, you're getting your carbs somewhere else, but they're the wrong ones. So it takes the testing to determine exactly what your body can handle and what it needs to cure what's going on, or to at least slow it down in some way, start it on the road to recovery.
Yep, exactly. 100%. 100%. And then Sjogren's is also associated with Epstein Barr virus. So we have the medical medium book out there now, which has become very popular. And anytime someone's talking about one thing causing all the problems, it's very provocative and enticing for the chronically ill patient population. So now everybody's in the medical medium book, he's talking about celery juice and how this is beneficial. And I'm not saying that it's not, and I'm not saying that Epstein-Barr isn't a piece to many autoimmune disorders. But to say that it is the cause of all autoimmune disorders, I do not feel is correct based on the current literature. So again, these are pieces to the puzzle. Have I seen Sjogren's patients who were mainly H. pylori dominant? Yeah. And we got rid of H. pylori, and did they feel better? Yeah. Am I saying that H. pylori is the cure for Sjogren's? I'm not saying that, but it is part of the recommendation in the research articles now to get rid of for someone with Sjogren's. However, I've seen other Sjogren's patients where it was more an Epstein-Barr problem. So again, it's patient specific, just like these dietary things we're talking about. It's patient specific. It's you. There is no one thing for these multi-systems, system biology problems, which are really encompassing our autoimmune epidemic at this point in time.
Well, let's use our auto analogy. We like those a lot. You might be a Chevy, you might be a Ford, you might be a Chrysler,
right?
You might be a Cadillac.
Yeah.
I mean, they all have an internal combustion engine in them.
Right.
Just like we all have a brain, we have a heart, we have a circulatory system. But we all know there are entrance, I can't even say it, there's my tongue not working. Those fine points that are different in all of us that makes, I mean, that's why sometimes it's so hard for doctors to find what's going on with people, even with a lot of testing and so forth that's being done. And I think you'd be the first to admit that testing's come a long ways here in the last, 10 years probably?
Oh, yeah. It's come a long ways in the last 10 years, for sure. For sure.
So the knowledge that can be gleaned from all of that then can be put into practice, and you figure out exactly which individual person needs. I think you have more ability to do that on an individual basis, like we've talked about before. Traditional medicine is so hemmed in by insurance and so forth. A lot of times won't cover testing, won't do some of these different things that folks really need to contend with some of these chronic conditions. But they should know that the help's out there, and whether insurance covers it or not, sometimes if you want to feel better, you kind of have to bite the bullet and go the extra mile, because there is help out there.
Right.
Unfortunately, our regular medical model doesn't seem helpful in a lot of ways to that. The doctors are busy; they don't have a lot of time, as you always say. But a lot of times, the insurance is kind of the culprit.
Yeah, I would definitely say that, and I would definitely say we get comments on YouTube about this. I went to my doctor. I suspected of having mixed connective tissue disease. And my doctor said, we can't run any tests at this point, or we're not going to go any farther. And the person is bewildered. Why isn't my doctor checking me? And they're blaming the doctor. It's not your doctor's fault. It's the fact that doctors get paid by insurance companies. Most doctors have to be in network to make a living through insurance companies. And when they're in network, the insurance company then says, okay, you can run these tests in this situation, you can run these tests in that situation, you have to treat a person for so long before we'll let you run these tests. And that's where it's so interesting, like when people go to the Mayo Clinic. When you go to the Mayo Clinic, they run every test under the sun, and most of the time, because people are so desperate, they're happy to pay whatever out-of-pocket expense they have to at that point, or maybe they have to get a lot of insurance approval to go to the Mayo Clinic to get all these tests run that wouldn't normally be run. But lots of times that's what's needed in the workup of a chronically ill patient. And when I do talk to insurance companies, they say, well, this person has had, let's say, brain MRI. This person has had headaches for a long period of time, and have they taken XYZ medications? Do they have XYZ symptoms? And have they tried this? Well, if we've done all that, then they can have a brain MRI, versus you're thinking like, yeah, this person should have had a brain MRI like 5 months ago. That's the difference. And so that illuminates that point. And then Kathy, we were talking about, or we had a question, so how is H. pylori eradicated from the gut? Great question. Most commonly in the medical world, they use what's called a triple therapy, which are 2 antibiotics and a PPI, a proton pump inhibitor, which reduces acid. The antibiotics usually use, I won't go into them, but there's 2 main antibiotics. Other times, other antibiotics are used. That's typically how H. pylori is eradicated. In the natural world, we use natural antibiotics, which some people may raise their eyebrows at, but I've seen really good results. And in fact, a lot of the natural agents are now being talked about for rebuilding the stomach lining in here with things like atrophic gastritis. So the natural agents can have a certain amount of power in nourishing that tissue in the stomach. So that's been my experience, and so that's how we do it. Also, relative to testing for H. pylori, this is an important point, because a lot of people go to the gastroenterologist and ask about H. pylori. And in my experience, looking through thousands of pages of medical records at this point, lots of times people have an endoscopy where they get a camera down their throat, going into their stomach, looking at the stomach tissue. And they take little samples of the stomach tissue out and test for H. pylori. It's interesting that I very rarely see someone come back as being positive for H. pylori, even though the statistics are that 1 in 2 Americans have the condition. And even the H. pylori breath test, which is where you drink a solution and then they test how much urea is coming out in your breath, because H. pylori produces urea. That's the gold standard test out there, but I see a lot of patients come back negative for it. So when you look at the incidence statistics, keep in mind that we're also looking at H. pylori antibodies. The blood test is gaining more acceptance as being accurate and sensitive. So you're looking for antibodies to H. pylori because maybe the breath test is missing it. Maybe they didn't biopsy the right area, but your immune system is fighting this bacteria. So that's also important to keep in mind in the testing and treatment of this condition.
So as usual, there's nothing that's totally black and white. There's always some gray spaces in there somewhere.
Right, exactly. And we had another question here, Kathy. Isn't that system a bit counterintuitive? People are looking for results more quickly than several months, sigh. And yeah, and that's how we're all being conditioned. And that's, we just have this instant gratification society at this point in time. So when you were growing up, Kathy, I mean, you wanted research, you had to go to your encyclopedia set and you had to talk to people. And I remember even as quote unquote young as I am, going through high school, there wasn't the internet. So we had to go to the library and we had to go to these books. I forget what they were. They had stacks of research articles, or you went to the microfiche. Things took longer back in the day. Now today, we've been conditioned to pill for everything. We got this treatment for that and this treatment for that, and you're being marketed to since I believe the late 1990s when that became legal for pharmaceutical companies to market different drugs to us. So now everybody's expecting, oh, I have a problem, it needs to be gone right away. And certainly the medical system is amazing at that for something like an acute infection, sinusitis, bronchitis, gastrointestinal bacterial infection. You break your arm. Of course, those things are wonderful. Those treatments are wonderful, life-saving procedures. But in the chronic world, individuals are looking for this instant fix, and lots of times these instant fixes are becoming very expensive, i.e. the biological medications used in rheumatology, which are running upwards of $1 trillion a year in costs. $1 trillion a year for these one subsets of medications. So yeah, I would absolutely agree with Lonnie on that comment. And getting to the underlying cause can take a little bit longer, but what is the long-term benefit? Long-term benefit is you're going to know what foods you can eat, what bacteria you have in your gut that may be causing the problem, and how you can control it, versus being at kind of the mercy of a medication and whether your insurance is going to cover that medication or not.
Okay.
Yeah.
Good information.
Okay. I think so. So any other thoughts that you have, Kathy?
I think that takes care of our Sjogrens. Just, I guess, be vigilant, people. Pay attention to your symptoms. Do some research. Ask some questions. And we're all in this together. Everybody wants to feel better. And as we said in the last segment, the chronic conditions are just that, and we need to pay attention to them. We need to find the answers. There are answers. People need to realize there are answers out there, and they don't have to be costly prescriptions or surgeries or whatever. There are a lot of natural cures and, like I said, good eating habits, that sort of thing, that take care. I just met a fellow down here, and I feel so bad. He has Parkinson's, and we had ended up at dinner together, and I didn't count how many drinks he had, but I'm sitting here thinking, that's the last thing you should be doing is having alcohol. And I felt so bad, but I don't say anything because people kind of get tired of me preaching. But, pay attention to what you're putting in your body. It is your fuel. And if you have chronic conditions, chronic pain, smoking, alcohol, gluten, I mean, those are like the top 3 things to go for to eliminate, and see if you don't see some big improvements.
I agree. It's not going to hurt you. And I know there's a lot of...
you can't do anything but help.
Right. They're going to say, well, you're not getting your B vitamins if you're not eating grain-fortified cereals. Yeah, I guess if you are basically borderline malnourished and you don't eat anything else except cereal, then yeah, if you take cereal grains away, somebody may become malnourished. So there can be harm there. But for most people who are eating if you eat a well-balanced diet, there is minimal harm in going gluten-free. So that's what I would say. It's worth a shot.
I'm not starving by any means.
Right.
I've never been accused of it. And I do take a B12 pill.
Yeah.
I mean, and I do that for several reasons. But and again, that's some of the testing that you do. I mean, you determine what things people are needing and what they're low in and what's going to help them out. And a lot of times, simple things like that. I mean, I know we're big on D, D vitamins. People don't get enough of that sort of thing. So getting those a lot of times can make a big difference in people's energy and so forth. So, but if you have the chronic conditions like Epstein, Barr, and you've got rheumatoid arthritis, or you have lupus or something, those are definitely the places where dietary changes to the good are a huge help. So that's me beating my drum again.
I'm with you. No, it's documented in the research. So yeah, I'm with you. 100%. Well, I think this was good. So we're wrapping up our doubleheader this Saturday morning, and any of you who are just joining, you can go back and watch. This replay will be available, and then I'll pull this video and put it on YouTube. And yeah, and I think that's it. That's all I have, Kathy. Anything else you have?
Okay. Yeah, I'm good. Everybody have a good weekend.
Okay, have a good weekend, everyone.